Okay, hi everybody. We're trying to get screen share going so you can see my PowerPoint. Looks like it's still working. Let's see. Okay, so yeah. Oh, that's so strange.
Shoot.
Viewing? Captions, comments. So sad.
Well, at least you can maximize yourself now, but
Okay. Okay, so now how can we tell when people are actually on or signed in?
So see on the little eye up there?
Yeah.
It'll say 2, so we got 2 viewers currently.
Okay, oops, we got 3 there. Hi guys, we're just trying to get all set up. I was going to share my PowerPoint, but I can't do that because technical difficulties. But I basically have my PowerPoint all ready to go. I think what we'll do is I'll just go ahead and get started. I'm going to just talk to you guys about chelation. If you do want a copy of this PowerPoint, you guys can send us an email. The email is info@nhicwestmi.com. And also on our Facebook page, which is www.nhicwestmi.com, there is a contact section. But if you just want to email us directly, it's info@nhicwestmi.com. We'd be glad to send you a copy of this PowerPoint. So I'm going to be looking back and forth to my papers because this is a little bit technical. And I'm going to try and be mindful of my time here, but it's 6:05. I'm going to try and get done before 7. But this is a very complicated subject. I'm going to try and simplify it as much as possible. But what we're going to talk about tonight is heavy metal toxicity, heart health, and chelation. Although it does involve a little bit more than heart health. So I'm just going to read you a quote from the CDC. The epidemic of cardiovascular disease, as well as immunological and neurological diseases, is likely associated with environmental toxins. So one of the things that we recommend here, this is just like a little, if you can do nothing else, do at least this. We have these lovely products here. And I'm sure you can't see them that well, but we have Ultra Clear Renew and Ultra Clear Plus. Those are Metagenics products. They're protein drinks. I do, in fact, I'm in the middle of doing one right now. Every morning I have my Ultra Clear Renew drink. And the Ultra Clear Renew will do a little bit more for heavy metals, but it takes out lots of other toxins. Essentially what these things do is they upregulate your phase 2 liver detoxification so that you can get rid of more chemicals in your body. And hey, I just did a chemical toxin test myself, and even though I eat probably 80% organic, I exercise, I sweat in a sauna, I do lots of things. I had some toxins in my body. I mean, they are just ubiquitous in our world. That's what we have to put up with because we live in an industrialized society. So we really do have to eat as well as we can and stay away from as many chemicals as possible because they are going to show up. And this is what I'm doing, Ultra Clear Renew, to get rid of some of those. I do it every spring and every fall. Very easy to do. I've modified the program a little bit so that you don't have to do 2 canisters. You can just do 1, and it works beautifully, and you clean up your diet, and you feel better afterwards. So the staff can tell you more about that if you want any of those. So heavy metal toxins. So we're talking about mercury, lead, arsenic, cadmium, nickel, and I'm leaving one out, aluminum. And you may have heard little things here and there, but I'm going to give some details. I did a seminar about 3-4 years ago, and it was all about heavy metals, and it is crazy how they are really ubiquitous in our society too. Again, another problem with industrialization. They actually have taken bones of people from about, I think it was 2,000 years ago, from like a museum, looked at those bones, and we have 70 times the lead in our bones today compared to those bones back then. So that's just the cost of industrialization. So, if we want those conveniences, we have to detoxify our bodies. So, effects of heavy metal toxins, I'm going to go through this for a little bit. It can be mercury, lead, arsenic, and cadmium toxicity. And these can be like not to the point where you're like, slurring your words, you can't function, you've got numbness and tingling. That's acute toxicity. We're mostly talking here about retained heavy metals. What happened over in Flint, Michigan, that was acute lead toxicity. That was enough to show up in people's blood. Well, even when it's not that high, you definitely are going to have some side effects from that. And I'll go through some of the research on that because it's pretty conclusive. But you can get things like hypertension, coronary artery disease, cerebral vascular disease, stroke, mini stroke, peripheral arterial disease, and other vascular diseases. Vascular effects of mercury specifically include oxidative stress. That means that you're going to make more free radicals. Those free radicals are going to cause more damage. And then those are going to cause inflammation. And what is inflammation? Inflammation is the major thing that kind of kickstarts that oxidative process that then causes plaque formation in the arteries and all kinds of things. It can also cause pain. It can cause, just not feeling well, just feeling like something not quite right, fatigue, muscle pain, etc. Subtle things that you can kind of work through, you can keep going, but, get a little bit harder as we age, especially. Or if you just don't deal with toxins very well. There's some people that, they just don't process toxins well. And that has to do with genetics and whatnot. And I'm not a big fan of studying genetics. I do a few genetic tests, but genetics are genetics. We can change some. We can't change our genetics, but we can change our genetic expression. So that's why we do a lot of testing for, minerals, nutrients, vitamins, the things that might go wrong in your body, like having elevated homocysteine because that's part of the methylation detox process. We can check those and we can change those. And then when we change those things and improve them in the blood or in the saliva or whatever test that we do, or urine test, we know that we're making a difference. And that would reduce any symptoms of neurological disease or vascular disease, or even reverse them sometimes. You add this stuff up with, like if you ended up having Lyme's, or if you had some other infectious thing like Epstein-Barr virus is another one that can be very toxic to the body and cause lots of inflammation and damage. But a lot of that can be reversed. So vascular effects of mercury include the oxidative stress and inflammation, thrombosis, so blood clots, vascular smooth muscle dysfunction. So in other words, like things that might lead to, blood vessel irritation, plaquing in the arteries, or just hypertension. Endothelial dysfunction, again, has to do with the insides of the arteries and how they function. Dyslipidemia, having high lipids or not, enough good HDLs or too many bad HDLs, bad LDLs, things like that. And also immune system and mitochondrial dysfunction. We are doing a little bit of a newer test the last year here called the OATS test. It's a pretty complicated biochemistry test, but it looks at organic acids that result from various biochemical processes in your body. And it can tell us about yeast overgrowth. It can tell us about bacterial overgrowth. But there's also a section in there about mitochondrial dysfunction. And not to get too far off the track, but mitochondrial dysfunction is affected by heavy metals. And mitochondria, you say, okay, what is that? Mitochondria are these little organelles. They're in every cell in the body. And basically, you have about 2,000 per cell. And those mitochondria, their job is to make ATP, adenosine triphosphate. That's one of the reasons we started doing ozone here at the clinic, because ozone is known to improve mitochondrial function. And basically every disease known to man, if you look up mitochondrial dysfunction and whatever it may be, COPD, CHF, congestive heart failure, fibromyalgia, Lyme disease, rheumatoid arthritis, anything like that, there has been a study on it because we know that all diseases have some kind of impact on the mitochondrial functioning. The other thing that mitochondria do is they get a little tired as we age. And so that's why we get these little wrinkles. And that's why we get other things because our body can't keep up with the demand after a while. So, yeah, mercury is one of those things. Really, all heavy metals are neurotoxins, and they all can cause free radicals, inflammation, damage, and mitochondrial dysfunction. So, hey, we're going to age anyway. We don't want to add to that situation, right? Me personally, I'm 39 and holding, so I'm going to stay there as long as I can and grow old gracefully. Okay, so heavy metals and circulation, we talked about, that a little bit just a minute ago, but basically, yeah, you're talking about damage to the insides of the arteries, that little bit of inflammation, that's the kindling for the fire, that's the body going, oh, something's wrong here. I have to, fix this up. I have to heal it, and then that oxidative process occurs, and then you get that plaque in your arteries. Of course, this can result in angina or, um, having a heart attack or things like that. We'll talk about some tests earlier that are later in the talk that can be done to see if you do have early signs of cardiovascular disease. There's lots of things that can be done, and a lot of them are really affordable. Some of them are totally covered by your insurance. Um, and yes, diabetics, that's another thing that the heavy metals, when you have heavy metal toxicity, that adds to the difficulty with the circulation getting to a wound or an ulcer, especially in diabetics, because diabetics have poor circulation anyway. They may not feel like it, but it's developing very slowly over 10, 20, 30 years, and that's why, they get foot infections and amputations and things like that. I'll never forget when I was working at another clinic, we had a patient who had a foot ulcer, and that person came into the clinic 3 times a week for chelation. Plus, they were on, other things in their program to improve their circulation, improve their diet, improve their blood sugars, and those ulcers healed. That person did not have to get a partial amputation of their foot. So it can be that powerful. But just like anything else, chelation, you have to remember, which I'll explain that word chelation in a minute, but it's part of a whole program. You just don't come in and go, hey, I want chelation because I had a heart attack. I mean, it does help, and we'll talk about a study that was done, and that was very conclusive that it is effective and it is safe. But chelation is something that's done in conjunction with a whole program. You must replace minerals and vitamins when you do it. You must also change your diet. You must also, live a healthy lifestyle, try to get rid of toxins, exercise, things like that, to the best of your ability, wherever you're at in age or physical ability. So that's how it works in conjunction with everything else. That's why we do holistic medicine. We're looking at the whole body and how all these systems work together. One interesting study on cardiovascular is that they did a study one time, and it showed that hearts with congestive heart, or people who had died of congestive heart failure, and congestive heart failure, the pump gets very weak and the fluids get congested. They can't get out to the rest of the body, so they back up into the heart, the lungs. And these are people who had passed away. They did autopsies, and in those hearts, this is mind blowing. There was 70,000, literally, that's 4 zeros, 70,000 times the mercury that were in hearts that they compared to regular hearts, people that died that did not have congestive heart failure. So mercury is a bad deal for the heart, and it definitely can make congestive heart failure worse. Okay, so other effects, you can have arrhythmias. You can have a blockage in these carotid arteries that go up to the face and the head and the brain. You can also have just generalized, atherosclerosis, blockage of arteries, and that could be, if you have had artery blockage around your heart, it's definitely elsewhere too. I mean, that's only looking here at the heart. It's not looking at the kidneys and the extremities and the brain and all these other places. So if you have any kind of blockages around the heart vessels here, it's elsewhere. And the beauty of IV chelation is that it goes everywhere. So I'll get back to that word chelation. I hope I'm not giving you all, just blank looks out there because chelation is kind of a big word. It really comes from the Greek word, the root word keel, which means claw. And the reason it's got that name is because when you look at chelating molecules, which are man-made amino acids, they literally look like this. And then in the middle of them is some kind of a salt or some sort of a mineral that's in there that's kind of keeping it all together. Well, if that chelation gets in your body, whether we're doing oral chelation or IV chelation, IV chelation is what we use for vascular disease. It goes around, and if it finds a heavy metal, it opens up and lets go of that mineral, and it grabs on to the heavy metal. And that heavy metal is very tightly bound in this like helical structure, and it does not let go of it until you pee or poop it out. So that's how chelation works. And we usually do a urine test to see how well it's working and to also get an idea of retained heavy metals or heavy metal burden on the body. And I have an example of that later, which I'll try to show you with my copied slides here. But it's basically the best test to see if you have heavy metals stuck in your body. Now, you may have heard of hair analysis or red blood cell analysis. Those are useful in some ways, but that by no means tells you how much heavy metal retention you have in your body. You absolutely have to do a urine toxic metals test with a provocative agent, meaning a chelator, in order to pull that stuff out to see what you have in the body. So we're looking at body burden there. Whereas if you take a hair sample, okay, that's what has come out in the hair in the last 2 to 4 months. If you do the urine toxic metals test for the retained heavy metals using the chelator, that stuff could have been in your body for 30 or 40 years. You can have acutely higher levels that do show up in the blood, like when they had the lead toxicity in Flint. That was acute lead toxicity, and that only stays in the blood for, say, 1 to 2 weeks. And then it's going to go in the body, it's going to go into the bones or into the other organs in the body, and it's going to stick there. It doesn't come out very easily. You've got a few mechanisms in the body for getting it out, but it doesn't get it out very efficiently, and then you're stuck with the stuff for a long, long time. So where do we find these heavy metals? Lead, and this is just a few examples. I'll go into more examples in a few slides from now, but lead can be in gasoline, paint, especially those homes that were built before, I think it's 1978, batteries, some cosmetics. They have a lot of that out of the cosmetics now, sometimes in jewelry too. Mercury, by far the largest load of mercury you will ever get in your body is from your fillings in your teeth. Now, I used to have, I think, 8 or 9. Sometimes, I'm not sure, I think it was more than that, but a lot of silver fillings. I got a lot of silver fillings when I was a kid. And basically, that is a huge source. It's worst when you're getting it put in your mouth and when you're getting it taken out. So we do have a list of dentists who are holistic biological dentists that do it appropriately. They take the appropriate precautions so you don't get heavy metal toxicity. And then there's also some binders that we recommend. Sometimes we do the oral chelator, DMSA also, that you take the day before, the day of, and the day after you get your heavy metal chelation or your heavy metal fillings taken out. Those are called amalgams. That's the silver fillings. If you have any silver fillings, I highly, highly recommend you get those taken out of your body because they're toxic. Every time you chew, every time you drink something hot or cold, the teeth will expand and contract. And when that happens, there is little microscopic vaporized particles of the mercury that are being let go. And those fillings are 50 to 70%, sometimes maybe even more than that, mercury. And that's bad for you. And I can attest, I had one mercury filling removed by a friend of mine who was a dentist who did not take the proper precautions. And I literally felt like a truck hit me. This is about 25 years ago. And I really didn't know much about this sort of thing. And I called some friends that I did know knew about natural medicine. And I went on lots of garlic, lots of chlorella. That was all I knew to do at the time. and it took me about two and a half days to pull out of that. And I wasn't sick with like a flu. I didn't have a fever. I just felt miserable. And that was acute mercury toxicity because I got all this stuff drilled out and I probably swallowed or inhaled a lot of it. And then I was reacting to it. So luckily I have some pretty good compensation mechanisms and detox mechanisms, and I got through that okay. So mercury, by far, the biggest source is going to be your dental fillings. There's also fish, there's paint, there's vaccines. Um, and so we always recommend that if people are going to get vaccines, they do the single dose vials. Single dose vials do not have mercury or aluminum in them as a preservative. Um, and then arsenic. Arsenic can come from crop sprays, groundwater. It's actually in the bedrock in Michigan and a lot of places, and chicken feed. Cadmium is mostly tobacco, tires, and plating on metals. Aluminum, cookware, aluminum foil, antiperspirants, antacids. Nickel is in cigarettes, plating on metals, and some soy and cocoa products. Other common sources would be power plants. These are like things that would get in the air and you might get them on something else or in something else. Power plants, automobiles, diesel fuel, metal foundries, paint. There's a lot of crafts that might have this kind of thing as part of the paint or part of the coatings or part of the chemicals that you might be working with. So if you do any crafts, check out the ingredients and also wear protective gear, wear a rebreather mask or at least some kind of a particulate filtering mask. Insecticides, fungicides, wood preservatives, amalgam fillings, as we just talked about, disinfectants, plastics, vaccines, drinking water, food, fish, and fertilizers. So lots of different things here. Now I want to talk about agricultural products real quick here. Crops and pastures can be legally contaminated. This is one of the biggest travesties here in America. What they use a lot of time in farming is zinc micronutrient fertilizers. And those fertilizers are also known as biosolids, which is sewage sludge. There's about 50 tons per year of mercury from combustion in the United States. That's coal-fired power plants. We have a lot of those along Lake Michigan. And municipal and hospital waste. Hospital waste is a huge one. In the top 10 states for emissions, this is a little bit older data, but it's probably pretty accurate. Ohio, Texas, Pennsylvania, Indiana, Illinois, West Virginia, Kentucky, Alabama, Michigan, Georgia, and North Carolina. Michigan's on the top of the list. So it's in the top 10. So now the amalgams, back to the dental fillings, some incredible information here. 3.4 tons of mercury per year goes into sewers, septic systems. There's 210 to 300 million people who have amalgam fillings. In fact, to me, it's really, incredible that they still allow dentists to put this stuff in our teeth. And it's not the dentist's fault. That's what they learn to do. That's what they're told to do. They're doing what is recommended, but that really has to change. And we are seeing a lot more biologic dentists, come into Michigan and all over the United States because they know that something's not right. A lot of them are actually very sick themselves. So, nowadays they're wearing masks and things like that, so they're definitely more protected. The ones who really know what they're doing, they're using very strict precautions when they take amalgam fillings out. Like they're using high flow suction. I went to a seminar earlier this year before the lockdown, and it was a group of dentists and doctors, and the dental lectures were just incredible. I mean, these guys showed a mercury measurement device over the patient, and they showed how much mercury was being measured, and it was huge. It was like 300 on the measurement. And when they used high flow suction, it went down to like 9 or something crazy low like that. I've seen it before at seminars. I was at a seminar once, and they weren't doing amalgam removal, but they took somebody with dental fillings, the amalgam fillings, they had them chew gum. First of all, they did the mercury measurement with this thing called a mercury snifter and measured the amount. It was like 5 or something like that. And then they chewed gum for about 5 minutes, and then they measured it again, and it was like 6 times higher. So chewing, hot and cold, anything that makes your teeth work, get the blood flow going to the teeth, that's always going to release some of that mercury in those silver fillings. So dental amalgams are the primary source of mercury in feces. And then we really need to, basically, bottom line is we need to get rid of its use in the dental industry, and that will decrease the environmental pollution of toxic metals greatly. Okay, so fish. People ask me this a lot. Fish, definitely, there's warnings from the FDA for children and pregnant women. Basically, the quote is, women and young children should not eat any shark, swordfish, tilefish, or king mackerel. I would add to that list tuna. And let's see, it says 10% of all U.S. women have blood mercury levels greater than the amount needed to create fetal risk. That's pretty bad. Like in their blood, they have it, enough to create fetal risk and neurological effects. And one of the 250 chemicals that is often found in cord blood when babies are born is heavy metals, mercury, things like that. Let's see. So fish to avoid. Put this little list up here for you so if you can see that. So it'll be in the lecture, but Mexican tilefish, shark, swordfish, grouper, walleye, orange roughy, king mackerel, tuna steaks, canned albacore tuna. Now there are some that are better, that are cleaned differently, so they might be better. But I personally don't eat tuna more than once every couple months. And Great Lakes fish, they all have some degree of heavy metal toxicity, and marlin. So those are the fish to avoid. Now, this is a list of fish that are pretty decent. You got your Alaskan salmon, you got your pollock, tilapia, Chilean sea bass, very nice fish, I love that one. Pacific cod, halibut, skipjack lake tuna, and trout. Those are going to be cleaner, and then you could do 1 to 2 of these servings per week if you want. Even on some of them, like the salmon, you could probably do 3. So that's that. So mercury. So now we're going to talk about lead. Get the lead out. Okay. So lead is really ubiquitous. It's probably the most common heavy metal toxin I see in the clinic. Typical sources, lead pipes in domestic water systems. They were there until 1970. A lot of the lead pipes are out there 600 feet from a person's house, especially if it's an older neighborhood. Glazed jugs, but especially red and yellow, like those little Mexican things you might buy when you're on a trip to South America or Mexico or whatever, especially the red and yellow. Lead crystal, embedded lead bullets, sniffing petrol fumes, or just being, maybe you're a highway worker or you work with engines or something like that. You can find it in there a lot. Herbal medicines. I'll show you later a test that was done, not at my office, but at another office, where somebody was taking some Ayurvedic medicines they got over the internet, and they were just loaded with lead. So I tell people, if you're going to do herbs, get organic herbs. We have a few herbs from the Ayush, A-Y-U-S-H company, Ayush Herbs. They're all organic. They're all tested. They're all clean, don't have any heavy metals in them. Paints, varnish, polishes, wine. I know a lot of you out there are not going to like hearing about wine, but wine is definitely got some lead in it. And there are better wines than others. See if I can remember this. Brazil, Argentina, and Italy have the best, most cleanest wines. About wine. For 432 wines tested. Now, this is the reference is the Bureau of Alcohol, Tobacco, and Firearms, Public Affairs Branch. They did a study of this a few years ago, and 432 wines tested in the bottle. The lead in domestic wines ranged from 1 to 521 parts per billion, with an average of 41. So they all had lead in them and some a lot more. The level in imported wines ranged from 4 to 673 parts per billion, with an average of 94. So actually the imported wines were worse, but Italy, Argentina, and Brazil are better. I've heard that Australian wines are better too, but I could not find that on the internet when I looked yesterday. So yeah, you gotta, get rid of that wine. Or only drink the wines from those countries because they're cleaner. Okay, so back to lead toxicity, or into lead toxicity a little bit more. Populations at risk for lead toxicity from increased bone turnover. So, as we age, you lose a little bit more bone. It happens when maybe you have a neurological disease and you're not using your muscles as much to stimulate bone growth. Maybe Parkinson's or MS or ALS or something like that. You're going to have weaker bones. Also women who are menopausal, or even andropausal men who are losing their hormones and not building their bone as much. So, if a person has hyperthyroidism, like it's super active thyroid, that can break down the bone more. Chemotherapy can do that as well. And of course, patients who have osteoporosis or osteopenia, or if people have vitamin D deficiency, which is 50% of the population. Maybe it's gotten a little bit better in the last few years because of increased awareness. But all of these heavy bone turnover disorders, what will happen is that lead that is stored in the bone, it starts to release. And this is exactly why women who go menopausal really should, if they can, do something to maintain their bones. If they can do hormones, that's great. It's the best thing for keeping your bones, especially progesterone. Progesterone builds bone, estrogen maintains bone. If you can't do that, there's certain calcium supplements that are good, others that are bad, but it's not just calcium, guys. It's magnesium, zinc, strontium, all kinds of minerals. And there's ways of checking that are not just a bone density that we can do by blood, but bone density is the gold standard. So if your bones are falling apart, then you're more likely to have lead toxicity, and that is the very reason why in menopause, in that older population, women have an increased risk of cardiovascular disease because the lead is dropping out of the bones with the bone breakdown. So let's see. Okay, this is kind of interesting. I learned this at my conference too. Autopsies show that the liver is the largest repository of soft tissue lead. And that's kind of right behind bone, because it's kind of like bone first, and then liver is the first soft tissue, so that gland. And that makes sense because the liver humanizes everything we put in our body. So yeah, you're going to have a lot of lead there. And then behind that, then it's the kidneys, and that's why the kidneys are affected so much. That may be a major cause of blood pressure, high blood pressure. Then behind that, pancreas, ovary, spleen, prostate, adrenal gland, brain, fat, testicles, heart, and skeletal muscle. So I guess actually I was wrong about the bones. The bones are kind of later in the line there, but still all of these organs can have it. So again, I'm going to make a little plug for Ultra Clear Renew. Ultra Clear Renew, if you can't do anything else, You can do ultra clear renew at least twice a year. Um, and there's other things you can do like glutathione, you can do N-acetylcysteine, you can do DMSA, which that's a prescription, but there's things that you can do to help pull out heavy metals. You know, even if you can't afford IV chelation, obviously that's going to be the gold standard for somebody who has heart disease, and I'll tell you more about that later. Um, Other sources of lead, lead in lipstick. In October 2007, a campaign for safe cosmetics tested 33 popular brands of lipsticks. And results, 61% of lipsticks contained lead, with levels ranging up to 0.65 parts per million. Lead-contaminated brands included L'Oreal, CoverGirl, and even a $24 tub of Dior Addict. So, yes, we have to watch those things, and I don't buy any of those commercially made lipsticks. I always buy natural stuff, or I use Burt's Bees or something like that. I never, ever use regular lipstick unless it's tested to be free of lead and other chemicals. Okay, other sources of exposure, purses, especially red and yellow color. Vinyl blinds, they deteriorate, and their dust contains high levels of lead that can end up on the hands and the mouths. Candles. Now, this is a big one. In fact, I bought a candle yesterday for my husband's birthday at the Hallmark store. It was from the Kalamazoo Candle Company, and there is no lead in their candles. So when you buy candles, look for lead or lead-free. The wicks can raise the concentration of lead in the air as much as 36 times that allowed by the EPA for many hours after the candle's no longer burning. So check those candles, guys. Okay, so then there's another interesting point I learned about at my seminar, and it's that there is no toxic threshold for lead. So what does that mean, really? No toxic threshold for lead. What that means is, according to the CDC, the Agency for Toxic Substances and Disease Registry, and the EPA, all of these guys, there is no threshold for lead. That means there's no measurable level of lead in the body below which no harm occurs. So, you know, if you have lead in your body, there's going to be some kind of damage. It's just a matter of how much damage, how much lead do you have in there. So that's, you know, not me, guys, and that's not my quirky, you know, integrative medicine stuff. This is the CDC, the EPA, and this Toxic Substances and Disease Registry Bureau. There's no level that's safe. So lead and other source of exposure, jewelry, especially if you get like cheapo stuff that you buy from China and stuff like that. There's a picture of a necklace here, and basically this necklace, when it was tested, 972,000 parts per million of lead. Yuck. Put that on your skin if it breaks down a little bit, especially if it's cheap metals. Oh yeah. That's why, like, the toys from China, you know, they actually test them now, you know, because they used to have tons of lead in them. And in China, they don't care. You know, they don't have a lot of, like, things like we do here, even though I don't love the FDA and the EPA and the CDC. They're not my favorite organizations. At least we do have them kind of looking out somewhat for us. They don't have any of that in China. They just do whatever. They're one of the biggest polluters in the world, unfortunately. Okay, so over-the-counter stuff, the Ayurvedic medicines. So this is what I was talking to you guys about earlier. There was an herbal preparation. It was Ayurvedic herbs. This person had bought them somewhere on the East Coast. They were taking the herb, and this patient had this is just unbelievable, a toxic lead level of 9,800 micrograms per gram in the urine. And this was on the urine toxic metals test that I was talking about earlier. And normal is less than 5. So less than 5 is normal. This person had 9,800. I mean, he was sick, and he had to get major detox. That was bad. He probably had super high levels in his blood, too. But again, don't depend on blood because blood's only going to show you the last 2 weeks unless you have an ongoing exposure. And I do the lead, mercury, arsenic, and cadmium and aluminum tests in blood, but I'm just looking to see, okay, does this person have ongoing exposure? You're not going to find an old chronic exposure that maybe you had 10 years ago or 5 years ago or even a year ago. Or, this stuff literally, they say it can stay in your body for up to 90 years. So you have to do the urine toxic metals test. And it's not that expensive. I mean, the chelation that we do to go along with that, it's probably about, I'm going to say around $100. And then the test is 65. So it's not outrageous to find out if you have heavy metals retained in your body. So drinking water, as we all know, the Flint was a great example, the Flint, Michigan disaster. Acidic chemicals added to water can magnify the uptake of lead into the body. 98% of homes have lead in their plumbing from lead and copper pipes connected by lead solder. And chrome-plated faucets are made of brass containing up to 8% lead. So, you got to check them, guys, and you can get your water checked. We have a water test here from Doctor's Data. There's also another water test I learned about recently, but I can't remember. I think it's watercheck.com or something like that. Checks up to 240 chemicals. I don't know if that does heavy metals, though. So anyways, you can get your water checked. And I think I pretty much explained the heavy metal retention. That's on our next slide here. I will say this, though. The Environmental Health Perspectives magazine, having to do with the National Institute of Environmental Health Sciences, they basically did some studies, and they showed that low-level exposures to these heavy metals are associated with long-term effects not previously recognized. And so knowledge of these adverse effects are based primarily on independent studies of a single toxicant. But the problem is when you have metals that are, in there with other metals or chemicals or having some kind of synergistic toxic effect, that's not tested. They really don't know the full-blown synergistic effects of, everything that's going on in this biological system. So we know they're bad, but it could be worse than what we know. And basically the other thing is, we don't have any, really concrete studies showing, that we have like certain limits that that we can handle to this bioaccumulation we're having in your body. And I think that just goes along with we're a biological system. It's going to be different for everybody. And so we do the best we can with the urine toxic metals test, where they're basically comparing you to various healthy populations to see what is good and what's not good. And then there's individual studies, but let's see. Okay, so adverse health effects. What might you be noticing if you have heavy metals? Fatigue, irritability, hearing loss, reduced IQ, infertility, hypertension, heart disease, chronic kidney disease. Those are going to be outlined in some studies I'm going to show you in a minute. Peripheral neuropathy, joint pain, muscle pain, gout, nausea, constipation, antisocial behavior, seizures, coma, death. Now those seizures, coma, and death, that's going to be your acute lead toxicity. Hypertension. Let's take a little trip down hypertension lane and heavy metals. Basically, hypertension and heart attack and stroke and chronic kidney disease, they all are related to lead. And there's some really good studies. I mean, I wish I had these to just show you on the slides, guys, but these are real studies, real detail. And I'm just going to give you the kind of the highlights here. But if you want our PowerPoint, you can definitely get that through the office. So in this study, basically what they saw was blood lead levels. Now this is blood below 0.48 micromoles per liter. That's 10 micrograms per deciliter in mortality in United States adults. So in this study, blood lead level was significantly associated with both heart attack and stroke mortality, not morbidity. That means you didn't do well, but you're still alive. Mortality is you died. Okay, so blood lead level was significantly associated with both heart attack and stroke death, and the association was evident at levels greater than 0.1 micromole per liter or greater than or equal to 2 micrograms per liter. Now that's much, much, much lower than the amounts that are suggested to be toxic. So that's some very serious information. So if you get a blood lead level test and your doctor says, oh yeah, it's totally fine, you know, you're in the normal limits, that may not be normal, especially if you do have hypertension or chronic kidney disease, or you've ever had a heart attack, or you have known vascular disease. It could be affecting you well before those toxic levels. Okay, so despite a greater than 75% reduction in blood lead levels since the 70s, which is good, that's our organizations working to help keep our products clean and whatnot, 38% of US adults have levels of that 2 micrograms per deciliter or greater. That was in the study about the stroke and heart attack that led to death. So it's, you know, despite reducing it in people, still 38% of US adults have this 2 micrograms per deciliter or greater. So 151 to 248% increase in death from stroke, and 88 to 189% increase in deaths from heart attack. And, you know, the list goes on, you know, neurological, degenerative, autoimmune, etc. Those are all related. And that was from the journal Circulation back in 2006. Okay, now there's another study that was done. This is lead associated with women and hypertension. So let's look at what that one says. So in that one, it says, at levels well below the current US exposure limit guidelines of 40 micrograms per deciliter. So they're not going to say that you have toxic levels of lead until it hits 40 micrograms. And remember, I just said 2 micrograms or higher, kidney disease, stroke, heart attack that led to death. Okay, so at levels below the current US occupational exposure limit guidelines, 40 micrograms per deciliter, blood lead level is positively associated with both systolic and diastolic blood pressure and risks of both systolic and diastolic hypertension among women aged 40 to 59 years. The relationship between blood lead level and systolic and diastolic hypertension is most pronounced in postmenopausal women. Remember what I said earlier about postmenopausal women? Their bones are a little bit more leaky. They have some of that lead coming out of their bones. That's probably why. And that's why I do hormones. If you can't do hormones, we can look at other ways that we might be able to keep your bones healthy. And you should all be exercising. Okay, we're coming up on 6:50 here. I'm going to try and fly through a couple of these. Another couple of studies here. Good information. So the relationship of bone and blood led to hypertension. It was a study called the Normative Aging Study in JAMA, the Journal of the American Medical Association, our big peer-reviewed journal of America. So basically, the conclusion was, our findings suggest that long-term lead accumulation, as reflected by levels of lead in bone, may be an independent risk factor for developing hypertension in men in the general population. So there you have it. In 1996, that study was done. It was published in JAMA, and they were saying, oh dear, you know, this could suggest long-term lead accumulation could be reflected in levels of lead in bone and maybe an independent risk factor for developing hypertension. And this was in men, I think they were looking at. Okay, another study here, lead associated with heart attack and stroke. Random blood samples greater than 2 micrograms per deciliter, very significant. Blood lead level was significantly associated with both heart attack and stroke mortality, and that was evident at levels greater than 2 micrograms per deciliter. That's the same study I showed you earlier. I put it here for emphasis. So, yeah, guys, low levels are bad. Lead bone stores associated with future ischemic heart disease or heart attack or angina. So in this study, this was done in 2007. Men with increased blood and bone lead levels were at increased risk for future ischemic heart disease. Although the pathogenesis of ischemic heart disease is multifactorial, lead exposure may be one risk factor. Another study, we found bone lead to be associated with all-cause, and cardiovascular mortality in an environmentally exposed population with low blood levels. The study suggests that cumulative lead exposure from prior decades of high environmental exposures continues to significantly affect risk of death despite recent declines in environmental lead exposure. So I think maybe I'll stop there, guys, but the main one I wanted you to know about is that one study that says, hey, if your lead level is greater than 2 micrograms per deciliter, and they're saying it doesn't have to be, it's not bad until it's above 40, that's a bunch of bunk. You can get heart disease, kidney disease, stroke, and hypertension way before that. So, yeah. And let's see. Here's another one about chronic kidney disease. Renal insufficiency. That's when you get that kind of minor kidney dysfunction. Your glomerular filtration rate, it's shown on your blood test as GFR. That's your kidney function, your kidney filtration function. And they're saying when it's just mild environmental exposure to lead, even at a low level, may accelerate progressive renal insufficiency. That's kidney insufficiency of non-diabetic patients with chronic kidney disease. Okay, so one of the things too that I wanted to go into is like, why is lead so bad for you? Okay, so there's this thing called nitric oxide. Okay, this is my little graph of nitric oxide. Okay, so what nitric oxide is also known as is endothelial-derived relaxation factor. They call it EDRF. And basically, nitric oxide, what does it do? It reduces multiplication of smooth muscle cells of the arterial wall. It reduces platelet stickiness. It dilates blood vessels. Like a lot of people take nitric oxide supplements like arginine, or here we have citrinox, or beet kind of supplements to increase their nitric oxide to help with their blood pressure. Nitric oxide also reduces oxidation. Remember we were talking about oxidation earlier, and oxidation is the thing that is started by the inflammation that caused you to put the plaque in your arteries. Yeah, that's it. So nitric oxide reduces that. It's a major component of reducing the plaque formation in your arteries. And it reduces the release of superoxide radicals, okay? I actually take something that increases my nitric oxide every day. So it's a signaling molecule. That's another thing that nitric oxide does. It's a powerful vasodilator. Yeah, the drugs like Viagra, those are based on that principle, okay? So, and remember what I said earlier, endothelial dysfunction, that's the lining of your blood vessels. The dysfunction of that lining of your blood vessels is the initial step in the pathogenesis or the formation of atherosclerosis, plaquing in the arteries, okay? So why does lead have anything to do with this? Endothelial dysfunction is the initial step in the pathogenesis of atherosclerosis. So one mechanism by which endothelial-dependent vasodilatation is impaired is an increase in oxidative stress that inactivates your nitric oxide. Remember earlier I was saying that heavy metals cause oxidative stress? Yeah, right there. That's it, guys. Full circle, full circle. You make oxidative stress, you knock out your nitric oxide, you start to have trouble with your blood vessels. So, the mechanism of the disease progression here with vascular disease is oxidative stress, which could be heavy metals or lots of other things, produces these free radicals and lowers the production of nitric oxide. And then this leads to hypertension, vascular disease, plaquing up of your arteries, um, cardiomyopathy or congestive heart failure, where the heart muscle doesn't work as well as before, and heart attack and stroke and chronic kidney disease. So if you guys have any of these, you should get your heavy metals checked. We can do that here with the urine toxic metals test. If you have them high, or even if you don't want to do the test, you could just do 30 chelations. That's what they did in the TACT study. So yes, we want to keep those arteries healthy, and we want to get rid of the heavy metals. And I already explained the difference between the hair, red blood cell blood tests, and urine toxic metals test. You've got to do urine toxic metals test if you want to really know what your retained heavy metals are. We do hair analyses and we do red blood cell elements testing, but that basically, again, just gives you what could have been there the last, 2 weeks to 4 months. And blood is only a couple weeks. So, yeah, I won't go into that stuff because I talked about some of that already. But let's give you an example of red blood cell elements, okay? This is a person, let's see if I can get the light right here, who has, see that Hg over here? Basically, Hg means mercury. This person's mercury is off the chart, crazy high, okay? So this patient was using a lightening cream called Facial Renovate, okay? It had 13,300 micrograms per gram. Yuck. Commercial fish is supposed to have less than 0.5 parts per million, which is a lot less. So if you're getting exposed to something like this every day, you're going to see levels like that. Like if somebody eats tuna fish every single day, you're going to see mercury like this, okay? So that can happen. And I don't think, let me see. I don't think I have the other ones, but there was another study that I had copied over from another clinic where these this family they were missionaires, and they were basically eating the chicken in the local area, and the chicken feed that was being given to the chickens had arsenic in it. Arsenic fattens up the chickens. This is why I only eat free-range chicken or Amish chicken or organic chicken. Because if they're putting any of this arsenic in the feed to make these chickens fat, I don't want to have anything to do with it, because these folks that were on this mission trip, they all come back feeling tired and whatnot. As an entire family, they had arsenic levels off the chart on their hair analysis. So yeah, this can be very bad. And it is 7:01, but I'm just going to finish up here, guys, and I'm going to tell you there's a lot of tests that we can do. I'm not going to go into all the normal levels or anything, but at our clinic, we will check levels of B12, B6, folic acid. We will also check ultrasensitive CRP. We will check homocysteine, that's a byproduct of the methylation detox cycle. We will check lots of specialized tests for like expanded lipid profiles. And we can see a little bit more than just, your HDL, LDL, cholesterol, and triglycerides. We can tell a lot from that. But also ferritin levels. Ferritin levels should not be high. Fibrinogen levels should not be high also. And then the other thing you can get, there's your EKG for your heart rhythm, your echocardiogram to look at the ultrasound of the heart, and then there's nuclear stress testing. Those are your typicals. But calcium scoring CT scans are really cool, and they are very predictive. They come up with kind of assessing how much calcium is stuck in your heart arteries. It is a CT scan. There is some X-ray exposure. There's some radiation, but it literally takes less than 5 minutes. So the exposure is way less than, it's like a chest X-ray. So they give you this a Gatson score. It comes in 3 levels: low, medium, or high. Sometimes it's in a percentage, but if it's medium, it's like relatively high risk of a heart attack in the next 3 to 5 years. And we've actually found a couple patients with that here, and we started them on chelation, and I hope we have saved their lives. Last but not least, I did want to tell you about the TACT study. I'm sorry I'm running over, but I do want to tell you about this, and you guys can play this later if you want to hear the end. But the TACT study was the trial to assess chelation therapy, and it was done, started about 15, 16 years ago, and it took about 13 years to get all the data done and to collect all the patients. They had 1,500 patients, 1,570 patients. And Dr. Antonio Lamas, he was a cardiologist down in Florida. A patient said to him, "Hey, what do you think about chelation? I really think, I should do it. I've got some heart disease." And he's like, no, there's no evidence of that. And then he got to thinking, he's like, hey, I'm a researcher. He's like, this guy was instrumental in making calcium channel blocker hypertension drugs. And he was like, I really should put a little more thought into this. So he looked it up. He's like, hey, there's some studies out there, but they're all really small. And he had the connections with the NIH and some of the people on the East Coast. And he basically got the NIH, the National Institute of Health, to give him $30 million to do this study. And it was awesome. And they broke them up into 4 groups: chelation, chelation with vitamins, just vitamins, and nothing. And in those groups, it was hugely statistically significant because all these people had had a cardiac event. They'd already had a heart attack. They were already on maximum medical treatment. They had their antihypertensives, or if they were on statin drugs, none of that was changed. And when they did chelation, there was by far way more benefit than a statin drug. They basically reduced recurrent events by 18%. And in the world of statistics, that's massively huge. If this were a drug, Dr. Lamas said that it would be a multi-million-dollar drug. But unfortunately, the patent on EDTA, which is ethylene diamine tetracetic acid, the amino acid we use for chelation, the patent went out in the 50s. So nobody can make huge amounts of money on it anymore. So basically, this study showed that hugely significant results. And the other thing is, surprise, surprise, they found out diabetics had about a 36% reduction in recurrent events. That completely blew away Dr. Lamas. He was like, every diabetic should be getting this. If they have heart disease or not, they should be getting this. And he's a traditional cardiologist, never did chelation before, ever. And now down at University of Miami in his clinic, he offers chelation because he can see that it really does work. And the other thing that this study proved, beyond a shadow of a doubt, it is totally, totally safe for your kidneys. It does not damage your kidneys. There was a couple of cases back in the 40s where people were giving massive doses when they didn't know that it could be dangerous to give massive doses. And they did have some kidney damage. But at the doses we use now, absolutely not. We can even do it on people who do have some kidney disease, and it actually improves their kidneys. I've seen it. So that is the TACT study. It was published. You can definitely find it out there if you want to check out the trial to assess chelation therapy. Dr. Tony Lamas, Lamas, was the lead investigator. So if you want more information, we also have a summary sheet here at the clinic if you want it. And again, you can get a copy of this PowerPoint. So suffice it to say, chelation works, heavy metal reduction works. Anybody who comes to my clinic and they have a neurologic disease or they have fatigue or anything like that, if we're not getting them better with lots of other nutritional things we do, we're going to check them for heavy metals. And sometimes it's a little bit of a hard pill to swallow for people because it's just so misunderstood. People don't understand that heavy metals are a real thing. And I hope tonight's talk, even though I ran a little bit long, did convince you that it's a real thing. And you need to be careful. You need to get those dental amalgam fillings out of your mouth. And you need to eat well. You need to exercise. You need to detox. We're here for you if you do want to do any of this testing. A lot of it's just not standard in traditional medicine, and it won't be for whatever reason. But we're here to help you guys. And if you did have any questions, I'm sorry I ran over. I can't do questions and this at the same time. So if you want to leave your questions for us, or you can contact the office, we'd be glad to answer those for you. And I thank you so much for sticking with me here, most of you. And if you guys need anything, please let us know, and stay healthy out there. And also a little information if you do need ideas on immune boosting, because we've got our fall flu season coming up. And the virus that shall not be named here can also be helped by all of the things we recommend for that. We do have an immune booster sheet, and we'd be glad to help you with that too. All right, guys, good night, and thank you so much. Talk to you later. Bye.